Hi, my name is Dana Arredondo, and I'm a nurse recruiter here at CVS, and I've been here for just about 15 years now. I've had opportunities to hire nurses across the enterprise, and that includes from our home infusion nurses under our Quorum CVS Specialty Infusion umbrella, and that includes nurses that work within Aetna and Aetna's clinical health services area. So, three things you can do to help improve your resume as a registered nurse. Keep in mind that there's a real person reviewing your resume, and that person might not be a nurse themselves. So the easier you make it for them to see how your qualifications match the job description and the requirements, the better. Number two, please make sure you're reading that job description and those requirements thoroughly, and then tailor your resume. You have all kinds of great experience back there, and bring it to the forefront, the specific items that are needed for that role. So say for a home infusion nurse, they need to have excellent abilities to start peripheral IVs. So make that a bullet point on your resume. As an example, we have on the Aetna side folks that are doing utilization management. There's going to be requirements that come along with that position, and if you have that experience, same deal. Make it a bullet point that stands out on your resume so that a recruiter isn't left wondering if this type of experience is something that you have had. Bring it to the forefront. Let's see, number three, the formatting of a resume. There are all sorts of online tools out there that can help you with those items, such as formatting and bullet points that look really nice, and bolding and font sizes and all that sort of thing. So you don't have to think about it all that much. You have all this great experience that you're trying to get on that page. You can let some of these tools do that work for you. Something to avoid. Errors. It seems obvious, but if you're toiling away and working on your resume and you've been looking at it for a while, it is very easy for a silly mistake to go through. So once you think you have that down, ask a friend or a family member to give that a quick read and see if anything jumps out to avoid those errors. So three things you can do to improve your interviewing skills. Of course, preparing for an interview, being on an interview, it's a nerve-wracking experience. I get it. But I advise to think of that interview as a two-way conversation. And when asked a question, it is okay to take a beat and think about your answer before replying. You don't have to start answering immediately. You will typically be asked, so point number two, you will typically be asked some form of a behavioral interview question, maybe multiple, in the course of your interview, and you will know what's coming when it starts with something to the effect of, give me an example when, tell me about a time when, those sorts of things. And we are looking for a situation, the situation you were in, the action you took, and the results of those actions. So get a situation in your mind's eye and tell the story like you would tell a friend. So we're looking for not only what you did, but how you did it. And what was that interaction like when you were speaking with your patient or one of their family members? How did you work with one of your peers, somebody that's part of that care team? And we want to hear it all. Let's see, point number three, have a couple questions prepared. When given the opportunity to ask those questions, we want you to come away from that interview having a better understanding of who we are and what we do, and of course, the position itself. To prepare for that interview, do a little research on the company, on us, the website. Make sure you're rereading that job description so that you know what that position is about, and you are prepared to ask some good questions for it. Something to avoid in the interview setting. I had to think on this a little bit, but especially when you are at the point of interviewing with a hiring manager, the response of, I want to try something new, that doesn't always go over all that well. They want to hear about what's compelling to you about their position from what you've learned so far with the job description, most likely also from an interview with one of the recruiters, and how your skill set will help contribute towards meeting the goals of that role. They want you to have the same passion and enthusiasm that they do towards meeting the needs of the team and, of course, the patients.